When we say anemia, what does that mean? Low blood count. Okay. So there are three causes of low blood count. One, you're not producing it. Why are you not producing it? Well, could be a nutritional problem. You're not eating the right food, or maybe you are eating healthy, but then it's an absorption problem. Something's wrong with your GI tract. You can't absorb the nutrients. Okay, you can't absorb B12, can't absorb folic acid, whatever. So that's one cause. Second is if you're not producing it, maybe you're destroying it. Okay, so hemolytic causes. So let's say you have sickle cell anemia, you have hemolytic anemia. Okay, and then the third cause is blood loss, either acute or chronic blood loss. That's basically it. So if you look at all these causes here, you read them, all of them lead to low red blood cell count. Different causes: blood loss, decreased production, increased destruction. Okay. Regardless, will your nursing care be different? Because all these patients have what? Low blood count. So therefore, do they have enough cells to carry oxygen throughout the body?
No.
So what is therefore your priority care?
Oxygenation.
And since do they have enough energy to carry out ADLs? So you balance activity with rest. And then the treatment, well, depends. What kind of anemia do you have? Is it a nutritional deficiency problem? Okay, is it a bone marrow problem? Remember cancer? Okay. So can we give them what were those injections again we give to increase red blood cell count? Erythropoietin, right? Or apoietin alpha, right? What's the other problems mentioned here is no, let's finish first. So if you're deficient in B12, that's what we give you. Okay. So you're deficient in folic acid, iron, that's what you're going to be given. However, if it's an absorption problem, meaning there's something wrong with your GI tract, you can't absorb even if you eat gallons of iron and folate and vitamin B12. Can you absorb it? No, you can't absorb it because there's something wrong with your gut. How do we give you those nutrients then? Those minerals? Parenteral. So we give you injections. Okay, so we give you B12 injections, iron infusions. Clear? Iron injections. All right, just like that. So if it's bleeding, then what do we do? If you're bleeding, do we allow you to bleed forever? Hey, we stop whatever is the bleeding. If needed, do we give you blood transfusions? Yes. Now, there are certain problems here. You've discussed sickle cell in peds, right? You should have. Yeah? What is sickle cell disease again? What causes it? What triggers it? Sorry. It's genetic. So what causes them to sickle? No, you have it. You have a defective gene. You have S hemoglobin S. What causes them to sickle? Because they won't sickle all the time. So what causes them? Remember, there's sickle cell disease and there's sickle cell crisis, right?
Yeah.
You get hospitalized for a crisis. So what causes a crisis when you're exposed to what? Stress is one, but overall, stress, smoking, flu, pneumonia, those are the various stressors. But what do all of those stressors cause? What do they do to your oxygen levels? They drop your oxygen levels. Okay, so let's say you are climbing Mount Everest. Is there enough oxygen there?
No.
Can you go into a crisis? Yes, you could die climbing Mount Everest. Okay, if you have sickle cell disease. So what's the management? And because they have so much pain, right? Pain management and fluids, right? Okay, so we give oxygen, fluids, opioids, and then can we give them transfusions? Yes. Let's go to polycythemia real quick, because this is a little bit strange. Polycythemia vera, why is it under anemia? This is actually kind of ironic. The patient has so much red blood cells, but they are abnormal red blood cells. So do they carry oxygen? They have decreased oxygen carrying capacity, which is ironic, correct? So the patient looks very red, very pink because they have so much red blood cells. As a result, what will happen? If your red blood cells are so high, what happens to the viscosity of your blood? Very thick. And what will form if your blood vessels are too thick? Clots. What happens to your blood pressure as well? Because that means if your red blood cells are high, then that means overall blood volume is high. So blood pressure will rise. So when we say clots, what could they develop? Stroke, DVT, PE, a heart attack. All right, so that's the problem in polycythemia. How is it treated? Can we donate this blood? Because I have so much. Okay, so it is treated. However, the cheapest way to treat it is periodic phlebotomy, therapeutic phlebotomy. I come to the hospital, let's say my hematocrit is 60. Okay, instead of what's the normal hematocrit? Around 35 to around 50, right? So my hematocrit is 60, 80. So what do we do? Take it out. Okay, so the phlebotomist will come up. They'll get a pint of blood. What do we do with that pint of blood? Can I give it to somebody? It's useless. Okay, so give it to a Filipino. They'll know what to do with it. All right, we have a very good dish for that. So that's one option to get rid of, we'll take blood out, perform phlebotomy, therapeutic phlebotomy. We will take blood until every other day until your hematocrit is normal. Okay, of course, we want to give you fluids as well, okay, because we're getting blood, right? So you're given fluids. Another option is, remember plasmapheresis to get rid of antibodies?
Yes.
Okay, so this one though, what will it remove instead? Will remove red blood cells, okay, because you have too much of it. Okay, so those are the options. And if the patient is tested and the cause of their polycythemia is cancer, then they will be given not IV, but oral chemotherapy, hydroxyurea. Remember that? Hydroxyurea. Same thing they give to sickle cell patients. And they'll be given aspirin, no anticoagulants, because they are at risk for clots. That's about it. Aspirin, hydroxyurea, lots of fluids to prevent clots, to keep circulation going. Yeah. Any questions?